The procedure is started by making an L-shaped skin incision on the lateral side of the heel to expose the calcaneus, the heel bone. This incision is used to protect nerves and tissues, which will allow for optimal scar healing. A saw template is used to make an accurate cut through the calcaneus bone. The template is secured to the bone by lightly tapping the pins in the template with a mallet. A saw is then used to make a precise cut through the bone. Once the cut has been made, the saw template is removed. The template will leave two perfectly sized holes for placement of guide pins. The calcaneal step plate is secured with two locking drill guide towers, and then placed over these guide pins. One of the pins is removed and a drill is placed through the tower for accurate drilling, direction, and depth for placement of the first screw. The drill guide is removed and the first screw is securely locked into place. This step is repeated for the second screw placement. Following placement of the second screw, the drill guides are then attached to the next available slots in the plate and used to push the cut portion of the heel towards the internal side of the heel. An S-shaped guide can also be used to assist the surgeon in pushing the heel into an accurate position. While maintaining this position, the surgeon will then place a drill guide through a slot in the plate, which will allow the surgeon to compress the plate with a screw into a secure and accurate position. Once the compression screw has been placed, the surgeon will then proceed to use the drill guide towers for accurate drilling, direction, and depth for placement of the remaining screws, to secure the plate into its final locked position against the heel bone. The surgeon will then repair the L-shaped incision with great care. This calcaneus step plate was designed with a low profile, so the patient should not feel any screws or hardware that have been secured into the bone. It can also be used in pediatric populations.